Few days back, in the comment section of our videos, one coder asked me to provide ICD-10 CM fracture care coding guidelines. If you feel something is difficult to understand, please mention the comment section of our videos. We will try to create videos related to those complex topics. So today's agenda will be: first we will learn fracture definition, next we will learn 6 steps to code fracture correctly using ICD-10 CM, and lastly we are going to learn checklist related to fracture ICD-10 CM coding. So what is a fracture? A fracture is a structural break in the continuity of a bone, epiphyseal plate or cartilaginous surface, usually traumatic with disruption of osseous tissue. In the easy term, you can call fracture as a break in the bone. Due to fracture, there is a discontinuation of continuity of bone structure. Most of the time, fractures will be due to trauma. And also, we are having pathologic as well as stress fractures, which we are going to learn soon. Next, steps to code fractures. So what is the first step here? Identify the fracture site. Determine the anatomical location of the fracture. For example, distal radius, femur shaft, tibial plateau, like that. In fractures, anatomical location plays very important role. So in order to code appropriately, you need to have the good understanding of anatomy of the fracture or anatomy of the bone. If you want to know more about anatomy related to bone, please mention in the comment section of this video. I will create one video related to anatomy of the bone. Next, you need to check in the documentation for laterality. As all of us know, we are having bones on left side and right side. So in order to code appropriately, you need to have the good smart skills to identify the laterality of the fracture. Most of the time in ICD-10 CM, for right you can see 1, for left you can see 2, for unspecified you can see 0 in the code descriptions. Next, second step is determine the fracture type, closed versus open fracture. So what is closed fracture here? So closed fracture means obviously there is no open wound. What is open fracture? So open fracture means bone breaks through the skin. So basically in open fracture, you can see the fractured bone with your naked eye. In closed fracture, you can't see the fractured bone with naked eye. You need to use here imaging guidance. Again, open fractures are further classified using the Gistilo-Anderson classification for long bone fractures. And try to remember, this Gistilo-Anderson classification is related to only open fractures. Whenever you want to code open fracture, you need to keep in your mind that we need to use Gistilo classification for long bone fractures. In Gistilo classification, we are having 3 variants or 3 types. First one is small wound, minimal soft tissue damage. So type 2 is larger wound, moderate soft tissue damage. Type 3 is extensive soft tissue damage, potential for infections. Again, type 3 divides into 3 variants. 3A is for adequate soft tissue coverage. 3B is for significant periosteal stripping required soft tissue coverage. And 3 is for associated vascular injury requiring repair. So what matters while using the Gistilo classification is type of the wound and amount of soft tissue damage. So are you looking for any job change? Don't worry. You can join in our WhatsApp group for latest updates about APC's pre-CE webinars as well as medical coding jobs in India, USA and UAE. Next, we will learn third step, identify the encounter type. So ICD-10 CM fracture codes use 7th character extension to describe the phase of treatment. First one is A, initial encounter. Most of the time you can see initial encounter in the emergency departments. So what is initial encounter? Active treatment is being provided. Next one is D, subsequent encounter. So routine healing, follow-up care. Next one is G, delayed healing. non-union, delayed healing. K is equal to malunion, P is non-union, S is sequela. Otherwise, we will call it as late effects of the fracture. Example, post-traumatic arthritis. So if you see the example here, S82.401A, unspecified fracture of right fibula, initial encounter for closed fracture. If the documentation does not specify whether it is closed or open fracture, you need to code it as closed fracture. Next fourth step is identify the specific fracture patterns. So fractures are categorized by pattern which affects coding. So transverse one is straight across the bone, oblique, diagonal break, spiral, twisting injury, comminuted multiple fragments, segmental, two distinct fractures in one bone, compression seen in vertebral fractures, and also most of the time you will see pathological fractures which is due to osteoporosis, malignancy or other conditions. So what matters here? So for example in the operative report if you see comminuted, so here comminuted means multiple fragments. So here you need to understand physician is telling multiple fragment fracture. For example, in the operative report, you will see the transverse fracture. So what is transverse fracture? So it is straight across the bone. Next, step 5, identify associated conditions. So for example, osteoporosis related fracture. So if a fracture occurs due to osteoporosis, we need to use M80 series codes instead of trauma related codes. Why means traumatic fractures are different and pathologic fractures are different. Next one is stress fractures. So if you want to code for stress fracture, most of the time these stress fractures are due to running and overuse M84.3 series for repetitive stress injuries. Next one is pathologic fracture. Most of the time these pathologic fractures due to osteoporosis, cancer and metabolic disorders. So you need to use M84.4 series for fractures caused by bone disease. So what is osteoporosis here? So softening of bone is called as osteoporosis. So here bone become porous. Next one is step 6. Last one is the step 6. Apply additional coding guidelines. So what do you do if the patient is having multiple fractures? You need to code each fracture separately and you need to sequence the more complicated or severe fracture first. So how do you code fractures with complication like infection and nerve damage? That time along with the fracture you need to use additional code to specify the complications. And also most of the time for traumatic fractures you need to use external cause codes also like fall, motor vehicle accident, etc. So here we are having few examples related to fracture. Whenever if you want to practice this, you can practice using these example scenarios. So what is the final checklist for accurate fracture coding? First, you need to check the anatomical site and laterality. Next, you need to determine if the fracture is open or closed. Next, you need to identify the fracture type and pattern. And also, you need to assign the correct encounter type for 7th character A, D, G, K, P, S. So I have already created one video related to these 7th characters. Please watch this video. You can see in the I button of this video. Next is for check for underlying condition. So what is the reason for fracture? So whether it is due to osteoporosis, malignancy, stress fractures or any type of traumatic fractures. And also we need to check for complication related to fractures and we need to code those complications separately along with fracture code. So thank you guys. Thanks for visiting our channel. If anyone looking for same day surgery coding, IVR orthopedic surgery training, please send WhatsApp message to 707-526-3939. If you like this session, please click on like button. If you are having any doubts or any complexity, please mention in the comment section. If you are visiting for the first time, please click on subscribe button in order to motivate me to provide more valuable videos like this.